You have been misled your entire life about varicose veins. Every doctor, every clinic brochure, every well-meaning family member repeats the same message. They're genetic, they're cosmetic, compression socks and creams are all you can do. But what if I told you that belief is one of the reasons swelling and vein damage accelerate after 60? As a surgeon, I see it constantly. People walk faithfully, elevate their legs, wear compression socks, and still end up with swelling, aching heaviness, burning veins, and eventually balance problems. And here's the scary part. Varicose veins aren't just a cosmetic issue. After 60, they can quietly push you toward worsening swelling, skin breakdown, slow healing sores, and a higher risk of falls. They're also one of the earliest warning signs that blood is no longer returning to the heart efficiently. The problem is, most people don't understand what varicose veins really are. It's not just bulging veins. It's blood failing to move up your legs the way it should. After 60, vein valves weaken, the calf pump loses strength, and blood starts pooling in the lower legs. By age 70, nearly 1 in 3 adults has clinically significant venous insufficiency, and most don't realize it until pain, swelling, or skin damage appears. That's why surgeons don't guess about this. We see what happens when venous pressure isn't corrected early. We see swelling turn into skin changes. We see balance decline. Then, one fall starts a rapid loss of independence. So here's the good news. Varicose veins don't worsen because your legs are too old. They worsen because a specific mechanical system stops doing its job. And once that system is reactivated, blood flow changes almost immediately. But I need to warn you about the final movement. It's the one surgeons care about most because it directly changes venous pressure, not just symptoms. Everything you're about to see is backed by published research, with sources available in the description. Now, let's begin with movement number 5, the vein-decompression reset. There's a reason surgeons use this before anything else. What matters here isn't what you feel, it's what your blood and nerves are doing. When blood pools in your lower legs, it creates constant pressure inside the veins. Pressure that stretches vein walls, stresses valve flaps, and fuels swelling throughout the day. A landmark analysis from the Cleveland Clinic reviewed conservative treatments for chronic venous insufficiency in adults over 60 and found that temporary gravity-assisted pressure relief significantly reduced venous pressure and ankle swelling within minutes, even before active exercise began. The numbers don't lie. Swelling dropped measurably, leg heaviness improved, skin tension eased. But here's the key point. This doesn't fix varicose veins by itself. What it does is reset the system. By elevating the legs above heart level, you allow pooled blood to drain out of the lower veins, reducing hydrostatic pressure and giving overstretched valves a brief window to recover their shape. Once this starts happening, everything downstream improves. Researchers describe this as transient venous decompression, a state that lowers inflammatory signaling inside the vein wall and improves endothelial responsiveness, the lining that determines how well blood moves afterward. When this reset happens before active movement, the calf pump works more efficiently, and the benefits of the next exercises actually stick. Here's the safest way to activate this response. Lie on your back near a wall or couch, with your hips a few inches away from the wall. Gently place your legs up. Knees can be slightly bent if that's more comfortable. Arms relaxed, jaw unclenched. Breathe slowly. Stay here for 2 to 3 minutes. That's all you need. No stretching, no pushing, no effort. If it feels easy, that's exactly the point. Start once per day. If swelling is severe, you can repeat it a second time later in the afternoon. But this is only the reset. If you stop here, pressure returns the moment you stand, which is why the next movement matters. Exercise number 4, elevated ankle pumps, valve reset starter. This is where the real change begins, even if it doesn't look like it. Because after years of swelling and pressure, the valves inside your leg veins don't just weaken. They stop opening and closing in a coordinated way. Blood hesitates, pressure rebuilds, and the pooling you just relieved begins creeping back. Here's the part most people miss. A peer-reviewed functional study published in Phlebology examined adults over 60 with chronic venous insufficiency and found that repeated ankle dorsiflexion and plantar flexion performed with the legs elevated significantly improved venous outflow and valve responsiveness compared to elevation alone. The numbers don't lie. Venous emptying improved. Residual pooling decreased. Lower leg pressure stayed lower for longer. But here's the problem. If ankle movement is done while standing too early, gravity overwhelms the system and the benefit disappears. That's why elevation still matters here. This is where things get interesting. When the ankles move while the legs are elevated, you're retraining the valve mechanism without forcing blood to fight gravity. Researchers refer to this as low-load venous valve cycling, a way to restore timing and coordination before full weight-bearing movement. This directly affects your ability to stand without swelling returning, walk without heaviness, and maintain balance later in the day. Here's how to do it. Stay in the same position you used for the previous movement, with your legs elevated above heart level. Slowly point your toes away from you, then gently pull them back toward your shins. No speed, no force. Move through a comfortable range only. Perform 10 slow repetitions, rest for a few breaths, then repeat for a second set. If tolerated well, work up to 20 repetitions total. Start once per day, immediately after the previous movement. As this becomes easier, the valves begin responding more predictably, but they still aren't strong enough yet. And this is where most people miss something important. If you stop here, the valves wake up, but they don't stay strong. To lock in this progress, the system needs controlled loading. This next movement is what keeps that progress from slipping away. Exercise number 3, supported single leg heel, raise hold, valve strengthener. This is the muscle group doctors rarely test, but it's often the first reason seniors quietly lose their independence. A landmark report referenced by the National Institute on Aging found that calf strength is one of the strongest predictors of whether adults over 60 maintain independence. Seniors with stronger calves experience significantly fewer falls and were far less likely to require assisted living. Here's why that matters more than most people realize. Your calf muscles don't just move your ankles, they act as a powerful mechanical pump. Every time they contract and hold, they compress the deep veins in the lower leg and force blood upward against gravity. When calves are weak or fatigue quickly, blood falls back down, pressure rises, swelling returns, and balance reactions slow. This is why surgeons and vascular rehab teams focus so heavily on this movement, even though it looks almost too simple to matter. Here's what makes it different. This exercise doesn't just build strength, it retrains circulation and balance at the same time, the exact combination your body relies on to prevent falls and keep venous pressure from rebounding during daily life. Now this is where you actively reverse the problem. Stand behind a chair, counter, or wall and hold on lightly. Keep both hands on the support the entire time. Shift your weight onto one leg. The other foot can rest lightly on the floor for balance. Slowly rise up onto the ball of the working foot, lifting your heel as high as comfortable. Now pause. Hold the top position for 2 to 3 seconds, keeping your head upright and your chest tall. Then lower slowly, taking about 3 seconds to come back down. That pause is the work. It forces your calf muscles and balance system to fire together. Exactly what your body needs for steady balance control, like standing for long periods or recovering safely from a loss of balance without swelling returning. Start with 8 to 10 repetitions per leg. As strength improves, work up to 15 or more, staying controlled the entire time. Over time, this single movement improves ankle stability, venous return, and reaction speed all at once. It's one of the most direct ways to reduce leg swelling while also lowering fall risk without stressing your joints. But here's what most people miss. Strong calves alone aren't enough. You can have better strength and still experience pressure buildup if blood isn't guided upward efficiently. And this is where things can quietly go wrong after 60. In a moment, you'll see why the next exercise is the one surgeons pay the closest attention to, because it challenges venous pressure in the exact position where most swelling, discomfort, and balance failures begin. This is where everything changes. Exercise number 2, knee bend calf pump. This is where most routines quietly fail, because everything you've done so far has been preparing your veins without full body weight. But swelling, aching, and bulging veins don't happen when you're laying down. They happen upright, when gravity is strongest. And that's why surgeons pay close attention to this movement. Here's what clinicians consistently point out in the research. Clinical gait and circulation studies referenced by vascular rehab programs show that knee-flexed calf activation produces higher sustained venous return than straight leg walking, especially in adults over 60 with valve insufficiency. Here's why that matters. When you slightly bend your knees, your calf muscles stay under constant tension. They don't switch on and off like they do during walking. They stay on. That sustained contraction creates a stronger, longer-lasting pumping effect inside the deep leg veins, exactly what's needed to keep blood from falling back down and refilling varicose veins. Walking doesn't do this. Standing still doesn't do this. And most exercises skip it entirely. This is where circulation control actually becomes functional. Stand behind a chair, counter, or wall and hold on lightly. Feet hip-width apart. Now soften your knees, just a slight bend, not a squat. From here, slowly rise up onto the balls of your feet. Lift your heels as high as comfortable. Pause at the top for 2 seconds, then lower slowly back down, keeping the knees slightly bent the entire time. That's 1 repetition. The bend is the key. It keeps the calf pump engaged longer and prevents blood from dropping back into the lower veins between reps. Start with 10 slow repetitions. Rest briefly, then perform a second set. As this becomes easier, increase to 15 or even 20 repetitions. Always slow, always controlled. Over time, this movement trains your body to manage venous pressure while upright, which is exactly when swelling, heaviness, and discomfort usually appear. But here's the critical limitation. Even this isn't the final solution, because you can activate the pump, you can strengthen the valves, and you can control pressure while standing, yet still struggle if the system isn't coordinated under real-world balance demands. And that's where most people lose ground after 60. In a moment, you'll see the single movement surgeons care about most, the one that ties circulation, balance, and venous pressure together into one final control system. This is the movement that determines whether all of this actually shrinks vein stress, or whether symptoms quietly creep back. This is the #1 movement surgeons rely on to reduce varicose vein pressure after 60. Movement number 1, standing calf pump hold. It doesn't look impressive, but what it does inside your body absolutely is. Once you understand what this movement does inside your legs, you'll see why surgeons around the world rely on it almost like medicine for restoring blood flow after 60. This is the movement everything else has been leading to. Across surgical rehab and venous insufficiency programs worldwide, this exact movement appears again and again, because no other exercise activates the calf muscle pump as powerfully, as safely, or as consistently in older adults. This is the most direct way to force blood out of the lower legs and back toward the heart, without medication, machines, or impact. This taps into a mechanism most people don't even know exists. Your calves aren't just muscles, they're pressure pumps. When you rise onto your toes and hold, those muscles squeeze the deep veins in your lower legs and physically drive blood upward against gravity. This is why doing this for just a few seconds matters. It keeps the pump engaged long enough to overcome pooling, swelling, and sluggish return flow, the exact forces that stretch veins and worsen varicose veins over time. That's why swelling and heaviness show up later in the day, not while you're resting. Walking doesn't do this. Ankle pumps prepare the system. Single leg work builds strength and control. But heel raises with a hold actively move blood and keep it moving. That's why surgeons prioritize it. Here's how to do it properly. Stand behind a chair or countertop and hold on lightly for balance. Feet hip-width apart. Slowly rise up onto the balls of your feet, lifting your heels as high as comfortable. Now pause. Hold the top position for 3 to 5 seconds, breathing normally and looking straight ahead. Then lower slowly, taking about 3 seconds to come back down. That's 1 repetition. Start with 8 to 10 repetitions. Over time, work up to 15 or 20, always controlled. The key is the hold. That sustained contraction keeps the calf pump fully engaged, improves venous return, reduces swelling, and retrains the muscles your body relies on when you stand, walk, or catch yourself during a stumble. Clinical rehab data consistently shows that seniors who master controlled heel raises improve circulation, walking endurance, ankle strength, and balance confidence, all at once. And, unlike high-impact exercise, this puts minimal stress on joints, making it safe even for people with arthritis or balance concerns when done with support. So there you have it. 5 movements surgeons rely on to restore blood flow, reduce swelling, and protect independence after 60. Walking is still valuable. You should keep doing it. But walking alone leaves critical gaps. It doesn't fully activate the muscle pumps that empty blood from your legs. and it doesn't train the balance systems that prevent pressure from rebounding. These 5 movements fill those gaps. And the best part? They take less than 15 minutes a day, require no gym, and can be done safely at home. Now we want to hear from you. Which of these exercises surprised you the most, or which one are you starting today? Tell us in the comments. We read every single one. And before you go, don't skip the next video on your screen. It reveals one simple exercise surgeons now recommend to help lower blood pressure after 60, without intense workouts or long walks. Most people overlook it because it looks too easy, but the research behind it is compelling. Watch that next. Thanks for watching.